I am a nerd. I'm a faculty member here in the Department of Psychology at the University of Victoria. Recently, I've been working on a project looking at the mental health impacts of the COVID-19 pandemic in people in Canada and in BC. I think without our patient partners, we wouldn't have been able to do such a broad and accurate study.
Patient partner is someone who has a lived experience. If they're looking for a patient to sit at the table with the researcher, to work with them in designing what the research is like, I could be involved in that. Most often, these are remote online type of investigations. So I complete survey questionnaires about my ongoing experience, and that hope to give some insight on how a patient like myself deal with this particular chronic illness. You need the experience from people who actually lived through the condition we have.
A patient partner to me is the opportunity to share knowledge. If I went through this, or if I'm going through stuff, or if my son's going through this, there's bound to be at least one other person out there going through the same thing. And maybe they'll come into your office, maybe they'll come into the research project. Everyone on that research side of it has been very receptive. They've been very patient and willing to take the time to really wait for us to process what they're asking.
The public is extremely important with respect to research. That's kind of vital to really be able to bring in those patient perspectives and to make sure that we're answering the questions that need to be answered from the patient's perspective. We tended to use the ReachBC website to try to get our patient partners. We were able to get a good number of people who were interested, and then we, contacted them, and we were able to kind of develop a survey that gets at the questions that those people were interested in asking about the impacts on mental health of the COVID-19 pandemic.
ReachBC allows us to connect with exactly the people that we're most excited to talk to. Patient partners played an absolutely crucial role in understanding sort of the scope of the project, the different impacts. I've been able to see a number of times where the research has made a practical difference in people's lives.
If you're wanting to be a patient partner, do it. There's very little obligation. If you don't have the time, then you don't sign up for projects. But if you have the time, or you see something that's exciting to you or super interesting, then you're still in control, and do it.
Especially in the last couple years with COVID, there's a recognition of how important research is and how important it is to have very precise, focused research to get the job done. It's research that have kept me alive and keeping me alive on an ongoing basis.